So, ladies and gentlemen, my name is Sharon Whiteman, and I'm part of the leadership team at the Lyme Disease Association of Australia, and we're completely dedicated to each and every one of you. We've been working, some of us, for 13 years, all the way down to a couple brand new people this year on our board, and a great deal of gratitude goes to all the volunteers that give so much to help even, move the situation forward for each and every one of us. Today, we're very privileged to have Dr. Marty Ross. He's a passionate Lyme disease educator and clinical expert. He helps Lyme sufferers and their physicians see what really works based on his review of the science and extensive real-world clinical experience. Dr. Ross is licensed to practice medicine in Washington State, where he has treated thousands of Lyme disease patients in his Seattle practice. He's a graduate of Indiana University School of Medicine, Georgetown University Family Medicine Residency. He's a member of the International Lyme and Associated Disease Society and the Institute for Functional Medicine. He's a doctor drawn to helping the underdog, something that vibrates in tune with his soul. After Indiana University School of Medicine in 1988, Dr. Ross moved to Washington, D.C. to train in Georgetown's family medicine program, treating the urban poor, and his first job as a physician was working amongst the homeless on the streets of D.C. Since 2000, in his first clinic, he's attracted people with complex illnesses like chronic fatigue and fibromyalgia. And in 2004, Dr. Ross treated his first chronic Lyme disease patient because it was the right thing to do. As a group of people living with chronic Lyme disease, they're outcasts, they're medically underserviced due to the policies of the Infectious Disease Society of America, health insurance, and government health policy issues. Simply put, as a passionate educator and clinical expert, he loves helping people and is buoyed hearing the countless stories of health improvements from people and physicians using the resources he's developed through Treat Lyme. And he now has a new book called Hacking Lyme Disease or something similar. He'll correct me. And he's continuing.
That's correct.
He's continuing to pull for the underdog, which, I think all of us in Australia qualify for that label. So Dr. Ross, thank you so much for immediately saying yes. We're really appreciative.
Sharon, thank you for inviting me. It's good to be here tonight. Well, actually, in the morning where you are.
Yeah, it is 10
time here.
a.m.
Yeah.
So tell us more about, I'm the same. I'm happier when I'm contributing. I've been with the LDA since it started in 2010. And, while I've experienced a lot of loss through Lyme disease, it gives me a quality of life to be able to at least try to do something to make a difference for Lyme patients in Australia. Partly selfish, but also for everybody. And so it sounds like we have that in common. So tell us more about that start for you and that passion for the people who are most gaslit and marginalized.
It's interesting. So I was raised in the Midwest here in the United States and in a state called Indiana. And my parents were Catholics. And so we were raised as Catholic. And although I would not consider myself religious by any means, now I'm spiritual. I practice shamanism, for instance. Back then, I was raised Catholic. And that message of the Bible of take care of your neighbor, love your neighbor as yourself, take care of your neighbor, be the good Samaritan, that message really sat with me. It sat quite strongly with me. And that led initially to, and out of my family medicine, when I graduated, I went into family medicine residency that was devoted to working with urban underserved populations. So it's kind of a mission-driven part of me to work with underserved that came out of a religious background, if you will. And that brought me to Washington, D.C., where eventually I did work with homeless people. But I think, and then in the course of my career, I've migrated to these illnesses that just don't have a lot of doctors that are willing to do it, or are very politically controversial, leaving a shortage of healthcare for many underserved people, not just financially and racially like I originally set out to do, but more from just having a disease that's an outcast disease. And so that very much fits with that mission I have that comes more from my heart and my soul of helping people that need help. And people living with chronic Lyme are definitely definitely fit that charge, especially in your country from what's happening there as well too.
Yeah, absolutely. And I have a shamanic background as well, so that's good. We do need to be a good Samaritan, and that's what this is all about. So I know I'm so excited to see the title of your new book, Hacking Lyme Disease, because that will really help Australians who are so, abandoned by medicine in Australia. So I'd like to just go through the flow of that book and guide people so that they can, for those that really want to get going and try to make some change in their life, they can have some steps to take. So you started in the book with step-by-step action plans for herbal and germ killers in Lyme disease. Can you expand on that?
Yeah, so my book is called Hacking Lyme Disease, an Action Guide to Wellness. And I think the action guide sums that up. And then the hacking is very much, I want to put power in the hands of people to take charge of their health. The book is based on, or comes out of, an online information site I have directed at people living with the illness, not practitioners, but people living with the illness. And that's called Treat Lyme by Marty Ross, MD. The URL is treatlyme.net. And it's a site for anyone living with the illness. Now, the way I wrote that site very much was to give enough scientific background so people would have an understanding of what my recommendations were going to be. But the heart and soul of anything I write is, what can you do? Here's some action steps to take. And so that site has many, many articles, but I decided to take 40 of what I call the key articles from that site, the most used articles, if you will, and put them into this book. And so this book is really a compilation of things that you can find in the book, or you can easily find the information for free at my online information site. And that's the big thing. It's free. It's freely accessible. Even the book, the way I priced it is at $29.99 US. And I don't know what that converts to in Canadian or in Australian dollar or Canadian dollar for that matter.
Yeah.
But relatively affordable for the amount of information that I wound up putting into that. And so the flow of the book, there's an introduction section that basically it says, that explains that this is a compilation and gives people practical information that they can use. I will also point out, this is a book that practitioners use too. There's enough science that I put in here that a practitioner could use this as well too. And so then there's a first section is key information that somebody should know before they begin treatment. And in that section, there's 3 parts. One is looking at some research that's been done showing what is it that works. It reviews alternative medicines and prescription medicine options and comes to the conclusion that the best way to get well is to use antibiotics. And this is based on research done by a group called LymeDisease.org here in the States. But their review of people living with Lyme also, when they did their study, they asked people what got people well, and all the things that people tried, it was antibiotics was the key thing. And they didn't ask, what about herbal antibiotics? And so I would expand on their study to say, based on my experience, herbal antibiotics give great options as well too. And then the 2 other key things they found is that it took a year or more of being on antibiotics to get well. And then finally, your best chance of getting well is to work with a Lyme literate medical doctor. Now, for Australia, that's really going to be difficult to get help these days, unfortunately. And then it reviewed a lot of the alternative therapies, and looked at what people's experience were using things like Rife machines and ozone treatments, et cetera. And although those may give some benefit, they don't give a lot of benefit. And so the key thing to get well is you got to kill your germ with something, and either a prescription or, I will say, herbal antibiotics. And that comes from working. And I'll go through some of those with you here in a minute. The second part of that introduction section is to say, if you're going to treat, you got to protect your gut, because being on either herbal or prescription antibiotics may upset the balance of good bacteria in your intestines. And those bacteria in the intestines, we now know, do a lot of things. They prevent yeast. They give chemicals that help your brain work. They give chemicals that direct your immune system. They remove allergens. They remove things we're toxic to. And so I have a whole section that says, take care of your gut, and here's some probiotic strategies to do it. And then finally, in the introduction, the last section is a review of key reasons that treatment fails. And there's about 15% of people, even when they get their year or more of prescription or herbal antibiotics, that don't get well. It's about 15%, but it's still a sizable group. And so in there, I review a number of reasons that might be. One is possibly that they didn't do a comprehensive enough treatment the first time. They didn't fix enough of the things. So key point I want to raise with you here is to get over Lyme disease and the co-infections, it is not just about poisoning the germs with herbal or prescription antibiotics. You have to fix all the imbalances created so that you can get your immune system working right to help you. And I'll go through some of those tonight. Other things, the reason that people's treatment might fail, I review in that article too. And I'll spare going through that right now, but I'll point your readers or your listeners to taking a look at that. Because if you know the things that make it so you can't get well, then you can kind of deal with some of those as you're going through your treatment, basically. Second part of the book then is my what I call the Ross Lyme support protocol. And it is a step-by-step guide on how you start your treatment and the various areas that you want to deal with. The third part of the book is about specific medicines that antibiotic medicines you might use, like dapsone, something called disulfiram, which is a drug we've used for alcoholism, but can give some help. Some herbal antibiotics, I review some of those. And then finally, the last part of the book is key supportive things you might want to do. Like when you get Lyme disease, one of the reasons you feel badly is your immune system makes a bunch of chemicals called cytokines. Now, cytokines are good and bad. On the good side, they turn the immune system on. But on the bad side, if the immune system's not getting rid of Lyme, or it can't get rid of the mold toxins that are trapped in you, or it sees too many yeast in your intestines, sometimes it can't deal with those problems and it's going to make too many cytokines. And too many cytokines give you what we call Lyme symptoms. So too many cytokines make it so you can't think, make you hurt all over, disturb your sleep, give you joint pain, body pain, cause neurologic dysfunction, and interfere with your hormonal function, your hormonal systems, like your thyroid and adrenal glands, for instance. So in that section, I have some key articles about how to deal with excess cytokines, how to deal with the dreaded Herxheimer reaction, the Herx, that worsening people get sometimes when we start treating. I talk about something called mast cell activation that sometimes people get, which is as a result of having Lyme, your allergy system gets overactivated. That's called mast cell activation syndrome. And I have an article in there about how do you deal with mold toxicity. So some people have a condition called mold toxicity, which it happens to 25% of all people. If we get exposed to mold toxins, they get trapped in us. 75% of us get rid of them, no problem at all. But 25% of people, whether they have Lyme or don't have Lyme, can breathe in mold toxins from their environment, and they get trapped and they gradually build up and they give a syndrome that looks just like Lyme disease because mold toxins trigger cytokine excess. So I talk about how do you diagnose that and how do you take care of that as well too. So again, 4 key parts of the book, information to know at the beginning, my Ross Lyme support protocol, a review of some of the key antibiotics you might use and other drugs you might use. And then finally, information about key supportive things you might try, like how to lower cytokines. Peptide therapies is the newest big thing that many of us are trying that I review in there, and a few other things I review in there as well too. So that's awesome. That's a long overview, but
no, that's great. So to guide people if they want to take action themselves, and most people in Australia don't have access to antibiotics right now. Right. There are some creative ways from overseas, but it's still a risk they'll get stopped at the border. So what would you advise people if they, imagine, how do they determine, do you have advice on how they determine what infections to target first and how to self-diagnose?
Sure. Yeah, I should have mentioned too, I forgot to mention, there is another section in here where I have antibiotic action plans for each germ you might get. So if you have Lyme or Babesia or Bartonella, and when I say antibiotics, I'm talking herbal and prescription antibiotics as well too. Yeah. So in terms of diagnosing Lyme disease, I think the starting place to look at is, do you have Lyme infection? And to make that diagnosis, there's 4 things to consider. One is, do you have a risk of getting a tick bite? Or did you have a tick bite? So if you have high risk, if you do things that might bring you in contact with ticks, like being a hunter, or being a backpacker or hiker, farming, those are things that might bring you in contact with ticks. Even if you never remember a tick bite, you could still have Lyme. You can still have it without having a known tick bite. 50% of the time people have Lyme, they don't remember a tick bite. So look at, do you have risk of having had a tick bite? Number two, do you have a number of symptoms that we see in Lyme disease? And so a good place to even look at that, for instance, if you're wondering, do you have a lot of those symptoms? I have an article on my site, not in the book, but on my site, I have an article that reviews those symptoms and talks about how do you diagnose Lyme. I like looking at a questionnaire by Dr. Richard Horowitz called his MSIDS questionnaire. If you were to Google Horowitz Lyme questionnaire, you'll find it on the internet, and just fill it out. If you have enough of those symptoms and score high enough, there may be a chance you've got Lyme. Third thing you want to look at is, are there any physical exam findings? And frankly, often people look good. They don't have the swollen joint. They don't have a dysfunctioning arm or leg. But if you have some of those, that kind of gives you some clues. And then finally, the last thing is, do you have a supportive Lyme test? Now, keep in mind, about 20% of the time that people have Lyme, they don't get positive Lyme testing. Now, where you all are located, getting Lyme testing is going to be difficult. The two main labs I would look at, which would be ones outside your country, one would be to use a lab out of Germany called Armin Labs that does a type of test called an ELISpot. An ELISpot looks at, asks the question, do your white blood cells called T cells, have they ever attacked a Lyme germ before? Okay, so, and if that T cell test comes back positive, that could be a clue you have Lyme. I prefer in the States, what I prefer to use actually is a lab called IGeneX, and IGeneX does a test for Lyme called an immunoblot that looks to see, has your immune system made antibodies against 8 different strains of Lyme, which would cover the various strains you would get in Australia as well too. That's my preferred way of doing it. So anyhow, you can have Lyme and not have a positive test. So you got to look at just the puzzle of, do you have enough symptoms? Could you have gotten it? Any physical exam findings, and do you have a supportive test? But again, 20% of the time people have negative tests as well too. Okay. So
I'll just jump in, Dr. Ross. We have the Horowitz, for anybody watching this, we have the Horowitz questionnaire on our site, and we distribute IGeneX and Armin Labs on behalf of those labs. So
yeah,
it's a free service. You just email us and we can send it out to you.
Yeah. So the thing about, if you're trying to keep your costs down, because testing can get expensive, I usually will start by looking to see if the Lyme infection is there first. And excuse me just a minute. I'm sorry about this. Hold on.
It's okay. Probably happened to me next. You're traveling right now, aren't you, Dr. Russ?
There. Hopefully he won't call back again. Yeah. Anyhow, sorry about that.
That's okay.
The trouble is my FaceTime feeds right into my computer. So anyhow, so my favorite, so in terms of testing, if you can get just one test done, you don't necessarily need to test for all the co-infections. That's expensive to do, is to just get the initial Lyme germ test. And through IGeneX, I like doing what's known as the Lyme IgM and IgG immunoblot. And that looks to see if you have antibodies from 2 families. I think that test will find Lyme if you have it about 90 to 95% of the time. And when it finds it, it is accurate 100% of the time. That is probably your best one. Then if that comes back positive and you have all the other things that say Lyme, like symptoms, risk factors, etc., then when it comes to the co-infections, the 2 big ones to be concerned about are Bartonella and Babesia. And you can decide to treat for Bartonella and Babesia primarily based on whether you have symptoms of those illnesses, rather than necessarily relying on testing. The reason I say that is testing is not perfect for either one of those infections. And so if the person has enough symptoms of a Bartonella or enough symptoms of a Babesia, in my practice, I'm going to treat. I may not even test for those unless the person wants testing to show it's there or not. Because again, if the symptoms are there, I want to cover for them, because having a co-infection of Bartonella or Babesia may keep you from getting well from the Lyme. Not treating those infections seems to protect the Lyme germ as well too. So not in the book, but at my site, there is a section, there's a section in my at treatlyme.net that is called an online Lyme guide. And when you hover over that online Lyme guide, a whole big mega menu will show up. And one of the options you have there is how to diagnose. If you look there, you're going to find my article on how to diagnose Bartonella and how to diagnose Babesia. In both of those articles, I do describe the symptoms that would make you think of Bartonella or Babesia. So for Bartonella, symptoms that make you think of Bartonella are having a lot of pain on the balls of your feet. Sometimes shin pain can be part of it. Having a lot of neurologic dysfunction, whether you have numbness or loss of feeling, inability to use an arm or a leg because of neurologic problems, seizures, psychiatric issues like ongoing depression or ongoing anxiety, not panic attack anxiety that comes and goes, but rather ongoing anxiety can be part of Bartonella. Another clue of Bartonella is if your thinking is impaired in a degree that is much worse than the degree of impairment you have in your energy. So let's say your brain function is 30% and your energy is 70% of normal. That's a relative difference, okay? So that's a clue to think of Bartonella being there. And then finally, sometimes people with Bartonella get a rash that can look like a scratch or stretch marks. And often will show up in the non-stretch mark areas of your body, for instance, okay? So if you have enough of those, you start wondering, could Bartonella be there? For Babesia, Babesia is a blood parasite that gets inside your red blood cells, much like malaria does, and has some symptoms kind of looking like malaria. So those symptoms are drenching night sweats is a common one. And not just occasional night sweats, because occasional night sweats can come from the cytokines. But these are the kind of night sweats that you get at least maybe 2 or 3 times a week or more, maybe nightly. And literally, you soak the bed. I mean, you can soak your undergarments and everything. They're really heavy sweats. Second clue can be having a lot of air hunger, feeling like you can't get enough air from time to time. That sometimes can be part of Bartonella too, but also is part of Babesia. Having a sense of imbalance, having headaches in the front of your head, having racing or skipping of the heart, getting lightheaded easily when you stand up. And then one of my favorite ones, just because it's kind of interesting, is sometimes people with Babesia get frequent deja vu experiences. They'll have just deja vu all like daily, maybe 2 times, 3 times a week, but more than you would expect, basically. So those are things. So anyhow, if you have enough of those Babesia symptoms or enough of those Bartonella symptoms, you want to treat for those as well too.
Wow. So that's great. So if people want to go more further with that, they can look on your website in that section and really study how to self-diagnose and to prioritize. So what do you treat first?
So I would take a look at my Ross Lyme support protocol, and it outlines various things you want to address. So step 1, and I'll just go through those real quick. Number 1, get sleep. Try to get 7 to 9 hours of sleep a night. And that may range from doing lifestyle things like turning off your computer early in the evening to actually having to use herbal medicines to knock yourself out. And if herbal things to knock yourself out don't work, then you might want to take a look at drugs. So in the protocol, I list in terms of things that you can consider to get to sleep. There's an herb called L-theanine, which is something that is an option, and I listed in the book. There's a number of herbs. They can find herbal compounds that would have things like L-theanine, 5-hydroxytryptophan, valerian root. Those are some other ones as well too. But you can find combinations that can knock you out as well too. I also, in my protocol, then list prescription medicines, and two common ones here in the States. One is something called Ambien, also known as Zolpidem. I'm not sure if that's available in Australia at all or not. It's a very short-acting one, but one that is easy to get, and you could even probably get your family docs to do there for you, is a medication we often use for depression, but has a good effect at getting people into long sleep, and that's something called trazodone. You can take it 25, 50 milligrams a night, and that sometimes could be helpful too. So in the protocol, I list that out. Second thing you want to do in terms of other things you want to address, I like to get my patients on something that's going to help lower the cytokines. I mentioned those cytokines earlier tonight. And one of the favorite things I like using for that is to use an herbal medication called curcumin. Curcumin is a component of the Indian seasoning turmeric, and it gets inside your white blood cells and tells them not to make so many of those cytokines, basically. And so I like to get all my patients on that. I usually will have them do 500 milligrams 3 times a day. If they can, I like them to get on what's known as a liposomal variety, something that is curcumin that's microscopically wrapped in fat, and that helps increase the absorption of the curcumin. So be on some herbs or lifestyle changes to get sleep, 7 to 9 hours of sleep. That helps lower cytokines, helps your immune system. Be on curcumin to lower cytokines, which also helps your immune system do better and may help you with some of the effects of Lyme. Third thing I like people to be on is something that in Ayurvedic and in Chinese medicine is known as an adaptogen. And these are herbs that help your body deal with stress. And the one I like working with is an herb called ashwagandha. Ashwagandha comes out of Indian and Chinese medicine and is shown in animal studies to help your adrenal glands work better and your thyroid work better. And so dose people somewhere between 400, 500 milligrams, 2 of those pills twice a day, first thing in the morning, and somewhere between 1 and 2 in the afternoon. Next up, I like to do is figure out, do people have low thyroid or low adrenals? And in the protocol, I list what are the symptoms that make you think low thyroid and low adrenals. So if you can't get a doctor that's going to test you, if you've got enough of the symptoms of low adrenals or enough of the symptoms of low thyroid, you want to work to support your adrenals and thyroid. And the most basic way you can do that actually is the ashwagandha I was just telling you about. So, and then the other thing I like to do at the beginning of treatment is to screen and see if people have too many yeast living in their intestines. Now, if you've noticed, I haven't even gotten to treating the Lyme germ yet, or Bartonella or Babesia. These are things you need to do to lay the foundation so that you get your immune system working better so it can help, in addition to poisoning the germs with the antimicrobials. So the reason to get yeast out is if you go on herbal antibiotics or prescription antibiotics, they're going to trigger more yeast in the intestines. And having too many yeast in the intestines causes more cytokines. And I already mentioned cytokines earlier, so we want to lower those down. So in the book, I have a screening questionnaire that people can fill out. And it looks at what are your risk factors for too many yeast and how many symptoms you have that suggest too many yeast. And if you score high enough on that, which is 140 or higher, then there's benefit for taking either herbal or prescription options to get rid of yeast. And I list out prescription, but herbal, which I'll emphasize here, you can find compounds that have a number of herbs in them. So for instance, you could find a compound that might have something called powder co in it, caprylic acid, rosemary oil, thyme oil, indolicic acid, garlic, grapefruit seed extract. These are all things that will kill yeast, and often you can find a pill that has many of them in there. And so you want to do a couple pills twice a day and also be on a probiotic as well too, okay? And then once we've got all that going, and sometimes that may be all I start with. If somebody's loaded with yeast for a month, I'm not even going to do anything to treat the Lyme germ. Now, if they're not loaded with yeast, you could go ahead and start treating Lyme and or one plus one of the co-infections if you have that right away. So for Lyme, in the protocol, I talk about I give you options, either an all herbal option to start with or prescription option to start with. On the prescription side, you can use either doxycycline or something called clarithromycin. And I like to combine those with an herbal antibiotic called grapefruit seed extract. The reason I do that is we recognize that the Lyme germ exists in different, it has different appearances. So there's something called a spirochete. That's the thing that looks like a corkscrew. There's another way that Lyme lives where it lives inside of cells. And then there's a third state, which is called a cyst form. Your doxy and clarithromycin are good at treating Lyme that lives inside of cells in the spirochete, but don't do anything to take care of that cyst. Grapefruit seed extract is an herb that can take care of that cyst. And I understand sometimes people can find antibiotics out of India, et cetera. Doxycycline, clarithromycin would be easy enough to find, and the herbal grapefruit seed extract is something they can come up with on their own. But if you don't want to do that, the herbal option would be to use a combination of, to start with, would be a combination of cat's claw and another herb called atoba bark. Those two herbs initially in a treatment have as great of a chance of helping a person as prescription antibiotics do. That's based on my experience. I see they work about 85 to 90% of the time, which compares with those prescription options. I usually have people start these liquid drops at 5 drops twice a day and work up to 30 drops twice a day. And if they get worse or have a herx as they're increasing, you stop increasing until that passes. You still keep taking it, but you have some flexibility about how aggressive you're going to be. And I have people add a drop per day to each dose. So if you start at 5 drops twice a day, the next day you go up to 6 drops twice a day. And you're doing it at both the herbal tinctures. Right now, those herbs are good at treating Lyme inside cell cyst and also the spirochete as well too. Now, regardless of whether you start with prescription antibiotics or you go all herbal, you also have to do something else. And this is based on some of the latest science we have over the last years. And that is, we now recognize that Lyme disease lives in a growing state and also can go into hibernation. And we call those hibernators persisters. And so most of us these days, as we design our treatments, are not only just giving something to deal with the growing ones, we also are having people take things to deal with the persisters. And so what I like using for persisters is an oil combination of cinnamon, clove, and oregano. And I have them take capsules of that. And so that is something I also have them do in addition to the cat's claw and the atoba, or that is in addition to a clarithromycin grapefruit seed extract, for instance, as well too. Okay, so that's just the Lyme germ. All right, now, if you've got Bartonella, the herbs to consider would be something called Hutania and something called Sitta acuta. And the herbs that you might want to consider if you have Babesia would be, the main one is something called Cryptolepis. And in the article, I tell you how to dose those, but those are herbal tinctures you can use as well too. How do you choose which germs you're going to start with? Well, if yeast is there, always deal with yeast right away. Okay. But then all things being equal, if you have all three, if you have Lyme, Bartonella, and Babesia, I usually like to go with Lyme and Bartonella first. And then as I start getting Bartonella symptoms under control, I like to add in treatment for Babesia. I do that based on the observations of one of my teachers, a physician here in the States called Burrascano, who's kind of one of the pioneers of Lyme disease treatment. Burrascano observed in his practice out near New York City, out in Long Island, that if he had somebody that had Lyme, Bartonella, and Babesia, and he tried to deal with Lyme and Babesia instead of dealing with Lyme and Bartonella, it became much harder to get rid of Bartonella. All right. Now, timing things, I'll just review with you here real quick. So an average treatment length for Bartonella is about 4 to 6 months. An average treatment length for Babesia is about 5 months. An average treatment length for the Lyme germ is about 1 to 2 years. And that's right. Now, in my protocol, I do list starting points, okay? But if those aren't working for you, then within, I mentioned there's a section where I have antibiotic treatment plans for every kind of infection. So if the herbal starting option doesn't work, then you would go to my Lyme disease antibiotic guide, where I give you even other herbal options. Or you would go to my an article I have called Kills Bartonella, a brief guide where I list out other things you can do for Bartonella. Anyhow, it's all within the book as well too.
And how do you tell if it's working or not working? It can be quite subtle sometimes, can it?
I'm sorry, I didn't understand you.
How can you tell if it's working or not working? Is it
Yeah, so that's a
symptom
good
related?
question.
Yeah.
Yeah. So here's the hard part is, so if you are on a treatment for Bartonella or for Babesia that is working, usually within 2 months, you should start seeing some improvement in those symptoms. So that's why I listed out the Babesia symptoms and the Bartonella symptoms. You look at which of those Bartonella symptoms or which of those Babesia symptoms you had at the beginning. And by 2 months, you want to start seeing those get better. If they don't, then you want to change to a different combination, whether it's prescription or herbal. Lyme is trickier. Lyme, there's a colleague of mine here in the States named Stricker that, maybe 15 years ago, presented a study at the International Lyme meeting here in the States, where he looked at how long does it take people to recover. And in his study, these were people that just had the Lyme infection, not Bartonella with it, not Babesia, not the other co-infections of Ehrlichia or Anaplasma. They didn't have any of those. They just had Lyme. And he put everyone on clarithromycin and also on flagyl to deal with the cyst form of the germ. And what he found in his practice, and he never published this, but he did present it at ILADS, and that is that by 3 months of treatment, only 30% of people started to improve. By 6 months, only 60% started to improve. And by 9 months, 90% started to improve. So when the Lyme germ gets to be trickier because it may take months of just continuing to hammer away with your herbs or your prescriptions before you start to see any improvement.
That's such good education. I wish I knew that 20 years ago. I had Lyme, Bartonella, Babesia, 5 positives of rickettsia and some viruses. And I didn't have a systematic approach to deal with it at all. So I think this is highly valuable for people learning and listening today.
Yeah, let me make another point too. If you've noticed, I haven't talked about rickettsia, I haven't talked about Ehrlichia, and I haven't talked about Anaplasma. In an ideal world, if people, the way that those are best handled is with basically a month of doxycycline, 2 weeks to a month of doxycycline. Not clarithromycin, not azithromycin, but the prescription doxycycline. Herbally, we probably don't have the greatest ways of dealing with those. So often what I'll do, I try to do with my treatments is to get at least a month of doxycycline into a person in case they have Ehrlichia, Anaplasma, or rickettsia. And that I don't know quite how you would get that arranged in Australia, but if there's a way to do that, to incorporate at least a month of doxycycline into a treatment that covers for the possibility of all those.
That's excellent advice. So what do you want to go treatment failure next, or what's your preference?
Yeah. So in terms of treatment failures, there's a number of reasons that treatment may fail. Number one, if somebody in my practice isn't getting better, or we treated for a year or two and they're not getting better, somewhere in there, I want to make sure they don't have mold toxicity. As I said at the very beginning here, mold toxicity, if you're one of those 25% of people that are genetically programmed in a way that you cannot break down mold toxins, it can look just like Lyme disease. And the way that I like to approach that is to get a urine toxicity study that looks to see, do you have mold toxins in you? here in the States, the two labs that are doing it, one is called Real-Time Labs. There's another one called Great Plains Labs. I am not sure how you get those tested in Australia. You may have some ideas on that, but you want to do a urine studies to see, are you peeing out excess mold toxins? And if you are, then the treatment is to take something that will bind them up in the intestines. And so you want to look, do you have that as a problem? Okay. And that's one of the big things. And then in terms of other reasons that treatment can fail, I mentioned in that chapter too, is if you got a Babesia or a Bartonella infection that you missed, that wasn't apparent to begin with, or wasn't treated at the same time as your Lyme germ, that can result in treatment failure. So I always want to make sure that people are periodically going back and looking at those symptoms of Bartonella and Babesia to see, could they have it? And if they do, they've got to deal with that too. Then other reasons, other theories as to why treatment fails. One is this idea that by using antibiotics, we create these hibernating persister germs. And there are two infections we now recognize that can have hibernator persisters. That's Bartonella and Lyme. And so these days, I incorporate, during my treatment, I'm having people take things to deal with persisters. My go-to is the cinnamon clove oregano I was telling you about. But if you can't find that, the other options to incorporate in your treatment from the beginning would be either Japanese knotweed, which looks like it, based on research at Johns Hopkins University earlier this year, it can go after Lyme and Bartonella persisters. The other option is Cryptolepis, which is an herb we traditionally use for Babesia, but it also appears to go after persister, Lyme, and Bartonella too. So if your treatment, if you didn't get better, but you didn't do anything to do with persisters, when you retreat again, you have to treat growing forms and persisters. Okay. Another reason that another idea why people may not get better is due to a tissue injury from having had the infection. And so one of the things I'd like to do these days, when I got somebody that I've treated for a year and a half, 2 years, and they're just not getting better, I like to work with what are known as peptides. Peptides are naturally occurring sequences of amino acids that we make on our own. And peptide therapy is big in Europe, starting to get some acceptance here in the States. I'm not sure what the status is in Australia, but there is a peptide. To put this in context, peptides are made up of amino acids. Proteins are also made of amino acids. We artificially say that if you have less than 40 amino acids put together, that's a peptide. If you have more than 40, that's a protein. It's an artificial designation, okay? And we estimate that there's over 100 different peptides that we know of right now that our bodies make naturally. And there's a number of them that are available orally. There are two that I like looking at in terms of tissue repair. One of those is something made in the stomach called BPC 157. And it's made in the stomach to repair intestinal damage and help intestinal function. But athletes discovered long ago, it's great with helping with their torn tendons, ligaments, shoulder pain, muscle pain. It helps recovery. And what I see in my practice is it's great for nerve repair and also muscle and tendon repair. And I've had some patients that I stopped antibiotics and they still had a lot of pains. And we got them on BPC 157, one 500 milligram pill or microgram pill twice a day. And within 2 to 3 months, they were back doing really well. So it can be pretty dramatic. The one that helps with brain function is a peptide called cerebrolysin. And so anyhow, I address that. There's an article I have in that book that is on how to use peptide therapies too. Another reason that treatment may fail is that the immune system just gets turned on, becomes having Lyme triggers autoimmune illness where your immune system starts attacking you. And one of the things that can be good for that is to use a medication called naltrexone. Naltrexone is a narcotic blocker that we use for people with drug overdoses, but in low amounts. So for instance, it's manufactured as a 50 milligram pill. When we use it as low dose naltrexone, We dose it anywhere from about 1.5 to 4.5 milligrams. And if you take that daily, it can sometimes turn down an overactive immune system that's attacking you, so it's not attacking you as much. Another reason that people may have perpetual ongoing symptoms is due to something called limbic system holding. So the limbic system is a part of the brain. It's in charge of your flight or fight responses and reproduction. And sometimes it gets triggered to be in an on position. And so what that is you basically, your body is revved up to respond to any of the symptoms that you have. And then you react even stronger with more pain or more anxiety or more insomnia. And there's a way that you can train that part of the brain not to be as overactive. There's a couple training programs. There's something called the Gupta method. And there's another one called by Annie Hopper called dynamic neural retraining system. It's a way of retraining that part of the brain through different exercises to quiet down, to stop being so overreactive, basically. And then there's another thing that we don't have a real good way of dealing with, but another theory why people don't get well is that their immune systems aren't able to clear out the debris of the dead germs. And having that germ debris, dead germ parts sitting in the body triggers ongoing inflammation, basically. It's a theory. But anyhow, those are the major theories as to why people have difficulty getting well.
One thing just popped into my head that comes into our inbox fairly regularly is people who've recovered and then have a relapse like 3, 5 or longer years later.
Yeah.
What is your assessment of why that happens and what can they do?
So the one thing I would always suggest, and I have people that, approach me for relapse at times too. The one thing I have learned in my practice is all that seems like a relapse is not a relapse. So the first question to ask when you start having symptoms is, remember I said Lyme symptoms are excess cytokine symptoms, okay? So you have to think in terms of, well, what else could be triggering cytokines? And one of the biggest causes of excess cytokines after a person has been treated, triggering what looks like a relapse, is developing too many yeast in the intestines. So having been on prescription antibiotics or herbal antibiotics, people remain a setup to develop too many yeast year, 2 years, 3 years, even 4 years down the road. Even if they've done probiotics, you still have that as a possibility. So when somebody comes into me with looks like a relapse, the questions I want to ask right away is, are you having increased sugar cravings? Are you having intestinal gasiness or bloating? If you're female, are you starting to get vaginal yeast infections, vaginal itching? And kind of a big clue too, in a certain portion of people with too many yeast in the intestines, those yeast release toxins that can trigger a lot of pimples or acne or eczematous reaction or eczema type skin reactions as well too. So my big thing I caution, your listeners here tonight, and also my patients, whenever they come in, I always look to see, is it too many yeast based on the symptoms? And if it looks like they've got enough things that suggest too many yeast, and they'll say things like, I was doing well until I took an antibiotic for my strep throat infection. And then about 2 months later, I started having all these Lyme symptoms return. Well, antibiotics is going to trigger too many yeast in the intestines. Okay. All right. So that's the first thing that I do whenever it looks like somebody has had a relapse. If they don't have too many yeast and they have relapse, I'll treat again. I'll treat based on what the infection is. Lyme, Babesia, Bartonella, I review all of them again to see which one came back. I'm going to treat them until they get well. And when we're done this time, I'm going to have a conversation with them about, do you want to remain on something to do germ control? Do we need to leave you on something chronically to keep Lyme in check, whether it's herbal antibiotics, and I might do half the dose I do when I use it for full treatment, or do you want to take 1 doxycycline a day? I'm going to work out a regimen with them. I'm going to offer to them the possibility of remaining on antibiotics to prevent further relapses down the road.
Thank you. I just glanced at the clock and smiled. Oh my goodness, this hour's flown by. Um, just two questions to complete. I know I promised an hour. Do you want to make a comment on things like SOT and Rife and hyperbaric and ozone?
Oh, yeah. So, ozone, I know ozone, people are very interested in it. And I'll say ozone, hydrogen peroxide, UV radiation of the blood. Those are things that a lot of alternative practitioners will offer their patients. And I think people sometimes feel better for doing those, but I would caution people that I don't think it's a germ killer.
Yeah.
And I want to tell you why I'm saying that. So the oxidation treatment that's gotten the most research done is ozone. And one of the big proponents of doing ozone therapy for a number of reasons. So this is a guy that believes in ozone, okay, did a research project where he took test tubes full of germs, put ozone into them, and he could see there was killing of the germs. He took the same test tube, put the same germs in, and put microscopic amounts of blood in, and then put ozone in, and there was no killing at all. So the thing about ozone, the way that ozone, hydrogen peroxide, and these oxidizing agents work is they damage the membrane of the germ and they damage the DNA of the germ through oxidation. Your blood is full of antioxidants. So the blood actually neutralizes the killing effect. So I don't think that they actually are good ways of killing germs. And even LymeDisease.org in its study, looking at alternative therapies, looked at how many people got better doing those type of treatments. And it's like 30 to 40%. The reason, though, I think people feel better is oxidation like that leads to better oxygen delivery to your cell energy factories called mitochondria. And you get an energy burst as your mitochondria start producing more energy, and you feel better for that, basically. But in terms of using those as germ killers, I don't think they're effective that way.
That's all. I had a massive improvement after 10 pass ozone. Absolutely. Like I could stand up without using my arms, or just like I'd done rehab or something, but I hadn't. But yeah, I get what you're saying.
Yeah, but it may be again from it really helped your
Mitochondria.
mitochondria function. Yeah.
Yeah, absolutely. And what would you like to leave people with today, for people in Australia who are working to recover and get back to a normal life?
Yeah. So what I will tell you, I would say it would be easier where you are if you could have physicians helping you. But let's look at that reality. It's not there right now.
Yeah.
I will tell you, I have countless stories of people that have followed my protocols like I lay out in the book and get recovery on their own. I get, emails at least twice every 2 weeks or so from somebody that said, I've taken your ideas and I've gotten better. So I want to let you know, even if you can't have a physician prescribing for you, if you look at some of the resources I have, there's hope. You can get better. Either get my book, or if you don't want to pay for it, that's fine. Go ahead to my site. All the information is there at my site for free, and start going down. Look at the Ross Lyme Support Protocol as a starting point, and that will point you in the direction that may give you benefit down the road.
Dr. Ross, God bless you. Thank you very much for your generosity today. I know it's going to help people in Australia.
Thank you for having me, and good luck to everyone listening in then too. And good night.
Good night. Good morning.